It is Monday, October 10th. I'm Jessica Lovell, and we are live here at Arrowhead Stadium this morning, and it is a big night here in Kansas City as the Chiefs take on the Raiders here at home. So big night later on tonight, but first, a big morning ahead.
I had my eyes closed because it hurts so bad.
A high school football player describes his pain after tearing muscles in his shoulder. The health system team that helped him get back to the game is with us this morning. Plus, making the crucial catch to fight cancer early to help save lives. Tonight, 7 cancer survivors and their doctors take to the Chiefs field to remind everyone to keep up with their screenings. And COVID hospitalizations are holding steady across the area, but now health experts are warning about a possible twin-demic. Dr. Hawkinson explains. Good morning. It is Red Monday, and we are so excited to be here at the stadium with all of you. Thank you for joining us here on Facebook, YouTube, and on Twitter. We know you will have lots of questions today, ranging from sports medicine care to COVID. So please go to the links there on your screen, send in your questions, and you can always post your questions in the chat below. Tonight, the NFL celebrates Crucial Catch, an event that draws awareness to the benefits of catching cancer early through annual screenings. Now, we told you that 7 of our patients and their doctors will take to the field tonight, and Tiffany Kessler is one of those cancer survivors, and she joins us this morning. How are you?
I'm good. Good morning, Jess.
Up bright and early. I love that. Thank you for being here with me. So tell us a little bit about, have you heard kind of how this is all going to work tonight? What do you know what you're going to be doing? Tell us.
We have heard a little bit. Myself, along with my surgeon, Dr. Ashcraft, and 6 other of the cancer survivors and their doctors are going to be on the field at halftime, and we'll be out there representing the 7 screenable cancers that Crucial Catch promotes.
And one of those is colon cancer. You are a colon cancer survivor. Tell us how that was detected.
Oh gosh, so I was diagnosed with colorectal cancer in November of 2021, about 2 months after I turned 40. I'd had, with a colonoscopy, I'd had some vague symptoms like some stomach upset, super tired, but nothing crazy. So after my doctors did some tests, and then I started to have some blood in my stool, and then at that point they decided that it was time to get a colonoscopy. And I was kind of thinking, you know, and I had a stereotypical view of what a colon cancer patient was, you know, male, older, ate lots of red meat, smoked, and I was none of those things.
You were not the picture.
No, I was 40 and young and
a
vegetarian.
Didn't have time for colon cancer.
No, so I, but, you know, went in for my colonoscopy and they found the tumor, and fortunately, you know, after that I was able to start getting treatment at KU right away, and I'm here now.
And all of the cancers that are screenable, I mean, colon cancer always has that stigma to it. It's tough to talk about, not always easy to talk about,
right,
but having someone like you here to put a face that isn't always typical with it is really helpful to people, and hopefully you're reaching somebody right now. What does it mean for you to be out on the field tonight? What's that going to feel like, to know that you're representing other cancer survivors and potential cancer survivors from screenings?
Right. I mean, I think it's such an important message. I'm so appreciative of Crucial Catch, the NFL, the Chiefs, that are putting this out there. I feel like they have such a big audience and a big range of people that they can reach with this message. And, you know, it is so important to keep up with those screenings and have, for your doctor to know what your health history is and to know what your family history is, so they can tell you when you need to get those screenings and how often, you know, colonoscopies and mammograms and pap smears and all the things. Just because when you do catch those cancers early, they're more treatable, the survivability is better.
Yes, you have more options, always.
Yes.
So last question before I let you go, but you were invited to a special lunch with some of the Chiefs players. You got to watch a preseason practice. Yes. What was that fun experience like?
Oh my gosh, that was so special. I was so grateful to KU Cancer Center and the Chiefs for letting us do that. We were not too far from here. At their training facility, and we got to eat lunch, and the Chiefs players kind of came in. We were able to mingle and get some autographs, and Mitch Holtis, the voice of the Chiefs, came in and he talked to us a little bit and told us kind of his family cancer story, and then was also able to give us some preseason looks on the Chiefs and what he thought about the season.
You were a total insider.
Yes, for sure.
Love that.
Know all the things now.
You have all the ins and outs. Your BFF is all the Chiefs.
Yes, met Coach Reed and gave him a big bear hug, so it was very cool.
Well-deserved moment for all of you. So again, 7 of our cancer survivors, including Tiffany, and then their doctors are going to be out on the field tonight at halftime. So my big advice to you is just have fun.
Okay. And don't trip.
Don't trip. Have fun. And no pressure, but we're all going to be watching.
All right.
Okay.
Thank you so much.
Thank you, Tiffany. We really appreciate you joining us. And again, we will be watching you tonight. Well, ask any athlete, and they will tell you injuries, they are just part of the game. But it was a single hit that took one Blue Valley North defensive end by surprise and landed him in the hands of one of our orthopedic surgeons. Jill Chadwick has that story.
I remember the day vividly because it was something that kind of changed my life.
It was 2021, Lee Summit versus Blue Valley North, and a tackle that Wanye Crofton will forever remember.
I was going to attack the offensive guard, and the offensive tackle came and hit my shoulder from behind. I felt it dislocate.
Player down for Blue Valley North as the trainers assess him.
Wanye didn't realize in that moment, but the tackle did more than just dislocate his shoulder. Still, he continued to play for as long as he could.
It was my senior season. I didn't want to miss no games.
Blue Valley North athletic trainer Miles Wilcox was on the sideline watching.
Probably with every snap, had a lot of adrenaline going. He was feeling some type of pinch, pain, numbness, and he'd come to the sideline.
Wanye's pain was actually from a torn shoulder muscle.
So it was a labrum tear.
The labrum is a thick muscle attached to the shoulder socket that helps keep the ball joint in place. Wanye would need surgery. Head team orthopedic surgeon for the Kansas City Chiefs, Dr. Paul Schreppel, is also an ortho surgeon for the Sports Medicine and Performance Center at the University of Kansas Health System. He would do Wanye's repair.
I had my eyes closed because it hurt so bad. And as soon as I opened my eyes, he was the first person I saw.
I want 10 good reps.
Post-surgery was when Wanye's hard work to get back in the game began with his athletic trainer.
He was in 3 to 4 days a week, just trying to get that shoulder right. So he was really motivated to do what he had to do off the field so that he could stay on the field.
The hard work paid off. Fast forward months later, and Wanye is making a return to the game with his new team, Mid-American Nazarene University. Injury, however, is still a part of the game.
After my shoulder stuff, I got cleared. During summer workouts, I was doing 60-yard sprints during summer workouts, and I pulled my hamstring.
And Dr. Schreppel will repair that too. Wanye says football will always be a part of his life and future plans.
I do got some stuff I want to accomplish later on in life. I do want to just find myself inside a good career. I just want to help with the community, really give back to the community, do little football camps.
Good job, Wanye.
What a story that one is. And as promised, here are 2 of our fantastic doctors, one who helped Wanye get back to the sport, and just 2 people who know a thing or 2 about football injuries, as they are Chiefs team physicians. Please welcome to our program head team orthopedic surgeon, Dr. Paul Schreppel, down all the way on my left, and also Dr. J.P. Darge, sports and family medicine physician, and former Chiefs long snapper. Guys, how's it going today?
Good.
Thanks for being out here early with me. I appreciate it. Okay, also joining us from afar is Wanye, and his mother Lauren is joining us as well. Good morning to both of you.
Good morning.
Good morning.
Good to see you, and love to hear that story, and so great to reunite you with Dr. Schreppel as well. How has the recovery been going, Wanye? Tell us, because you have a hamstring issue going on. Is that correct?
Yes, I do. The recovery, it's been going good so far. It hasn't been like any major setbacks or anything with the shoulder injury. So everything was kind of straightforward on what I needed to do. Therapy went pretty good. So now it's just working on this hamstring now.
Yeah, I mean, football just takes a toll, and that's why we're so glad to have Mom with us today, because I think, and the docs would agree, it's kind of like a family affair when you've got your kiddos out on the field. Lauren, what's that like, trying to help navigate all that and trying to make sure that you're getting the right care for your son? Tell us a little bit about that process for you.
Sure, absolutely. I just try to make sure that my son gets the best care possible. And when we were referred to the University of Kansas Health Systems and Dr. Schroepel, I was excited that he would be the surgeon to repair my son's injury. And he did an excellent job. And my son is recovering very well.
Well, that's tough because you never know when your kids are playing injured or not. I mean, they're tough kids. You can't get inside their heads all the time. But Wanye, I want to get back to your shoulder injury for a moment that you had. I wanted to know what that was like when you were told that you would actually, when Dr. Schroepel told you would need surgery for this. What was that like?
The thought process in my head was like, is there any way I could still play? Like, I wasn't really thinking about the surgery too much. I mean, you could probably ask my mom too. That was like the last thing on my mind was getting surgery in the middle of the season or just anytime recent. I just wanted to make sure it was after the season. So when he told me I needed surgery, I just kind of blocked that part of my mind out and was like, what I need to do to still play football this year.
Mom, what were you thinking when you heard the surgery word?
I know. Very concerned. My first thought was for him to just stop playing and go ahead and have the surgery. I did not want him to continue to play injured because I was afraid that the injury may get worse. But he was determined to go ahead and finish out the season. So immediately after the season, that next week we scheduled surgery so that he could start his recovery as soon as possible to be ready for summer camp.
Dr. Schroepel, you diagnosed Wanye with a labrum injury to his shoulder. How common is that particular injury?
So labrum tears happen as a result of shoulder instability the vast majority of the time. That's actually a pretty common injury for contact athletes. When you look at our incidences throughout all of our literature, young adolescent male collision athletes, so that can be rugby, that can be football, but they're our highest risk demographic, so it's fairly common.
Well, how often, though, are people playing and not realizing that they may need higher level of care or need to go into surgery? Is it something that, for Wanye, he's able to play through it, but you don't know how painful that is? And how do they know to come and ask questions and take this further?
Yeah, shoulder dislocation or shoulder instability event is usually a pretty traumatic event, so it's not something that is often overlooked unless it's a chronic problem, and that's a whole different subset of patients. So I think it's important for us out of the gates after shoulder instability happens is to really understand what concomitant injury may have occurred with that dislocation, because there are certain things that we say you can no longer play football safely and you have to have this fixed, but in the absence of some of those concomitant injuries, we can safely let an athlete go back, keep a close eye on him, make sure we optimize his rotator cuff strength, the muscles around his shoulder. If he does have further instability events, then often we'll have to go ahead and do surgery. But it's not uncommon that they can complete a season and then have it fixed afterward.
All right, Dr. Darsh, I'm going to ask you a question. I was going to ask you, as a former NFL player, did you ever suffer any serious injuries? Or should I just say, what serious injuries did you suffer, right?
I think unfortunately it's pretty much inevitable.
I guess.
You play long enough, you're going to have some kind of injuries. But I've been very lucky. I had a torn labrum in my leg that required surgery, and also a ACL surgery for my knee. But I got good care then, and I'm okay now. I can still walk and
you're okay now
exercise.
You're all protected in your white coat.
Exactly.
So you're off the field. But when you received those injuries, you had the surgery. What was it like were you able to get back and play? How would it have felt differently? Maybe like for someone like Wanye to get back. You may have been a little older than Wanye.
Yeah, I was quite a bit older than Wanye, but the big issue I think is if you have an injury like this is to recognize it early, go in capable hands, and if you do need surgery, a lot of these injuries, like in Wanye's case, he should do just fine, right? If you put in the work, put in the time to strengthen and get ready to go back, and most people with those injuries, they're able to return to playing.
So you get an injury, you have surgery, but how important is it though to make sure that you're doing that post-surgery rehab for someone like Wanye and other kids that are watching and seeing this all the way through?
Yeah, that's the crucial part. I think the surgeon, as good as Dr. Schroepel is here, he only does his part, but the rest of it is the athlete has to put in the work, strengthening, getting the range of motion back, working with our our physical therapists to get all that expert care to get the range of motion, the strength back, so they have good functional strength of their shoulder or hip or whatever it might be, so you're able to return and play.
You got to be a good patient.
Absolutely.
Absolutely. Dr. Streppel, how much does age, though, play into this? You were kind of describing who might need it and who keeps playing. Is the reason Wanye is able to go forward, is it because he's young? It's something that maybe somebody in their 30s wouldn't be able to do? How much does age play a part?
Well, age certainly plays into the incidence part of it. As we get older, these instability events happen less commonly. So I think within football athletes, whether you're in high school, college, professional levels, we kind of manage the care similarly at all those levels. So I think it's always good to be young. And I think back to the rehab part, I always tell our patients that the surgery is the easy part, the rehab's the hard part.
Yeah.
And it really requires their buy-in and their diligence and a lot of hard work that sometimes when you're 3, 4, 5 months into, is tough to maintain that focus and really continue to realize why you're doing it. So critical to do that.
So we talk about the physical part of it. Let's talk about the nutrition, about how nutrition plays into avoiding maybe injuries like this, but also post a surgery, and how this all kind of goes in together, kind of comprehensively focusing on the nutrition as well.
Yeah, nutrition is certainly a strong focus of ours right now, particularly within our research. No optimal nutrition is going to prevent a traumatic injury like a shoulder instability, but it certainly can help on the backside with the recovery. We've got some ongoing studies right now looking at branched-chain amino acids and some other supplements that may improve muscle recovery after surgery. We do other things within rehab, things like blood flow restriction therapy to optimize muscle recovery. So there's certainly a lot of that we're looking into right now, and it is an important part of the recovery.
So I'll ask Dr. Darsh then, how maybe some advice to parents listening or student athletes listening, young men and women, but are these type of things avoidable in any way? I mean, how do you change the way you approach a game, or how you play, or how you take care of your body when you step out onto a field or a court? What mindset do you do to make sure you're taking care of yourself, mind and soul and body?
Yeah, that's a good question. I think, can you avoid them? I think not totally. Obviously, there's bad luck, like you said, a dislocated shoulder or a knee injury. You can decrease your risk of having that by being strong, by being in good shape and training and being ready to go, keeping your hydration, your nutrition. But there's injuries that just are unavailable and they just happen. Question is, you try to limit the number of times that happens, and when it does happen, you have to get the appropriate care at the right time.
I want to ask Lauren and Wanye, just how do you play differently now? How do you take care of yourself when you head out to the field? And Mom, do you have new advice for your son as he heads out to play?
I do, and I agree with the doctors. Nutrition does play a big part in muscle recovery. So I play a big part in helping Wanye keep his nutritional values up. I help him a lot with his meal prep, making sure that he gets the right foods that he needs. I've done a lot of research as well myself in muscle recovery, and just try to make sure that he stays hydrated, and he works really hard. He's been working really hard in his rehab and therapy to get his strength back to the maximum level.
Wanye, anything to add to that about how things have changed for you for the better?
I say probably just my mindset, really, because after the shoulder injury, it was just like I was just lost in my thoughts a lot. Like not knowing if I'll be able to do this the right way or still be able to do this. So like once I got out of my mindset and my thoughts, that's really it.
Good for you. And Mom, hearing how you're doing so well, getting your kid to eat well and drink water and stay hydrated. It may have to have you come back on, to give some of your expert advice, because as a mother, that is not an easy thing to do. So bravo for getting him back on the right track.
Thank you.
Dr. Streppel, a quick question for you about Harvard scientists who earlier this year announced breakthroughs in 3D bioprinting of live human muscle tendon tissues. What is 3D bioprinting? How is it helping patients? Because this kind of sounds futuristic and very cool.
Yeah, so 3D bioprinting is something that's actually being looked at a lot of more of our tendon and ligament-based tissues. I think muscle tendon interface is going to be a little bit more challenging, but the idea is at least to replicate the exact anatomy that was there before the injury. Mm-hmm. Right now we have a lot of other options to either repair, sometimes even transplant cadaver tissue. A meniscus is a good example. If you tear a meniscus and we can't repair it, then it usually has to be at least partially removed. And sometimes when a large part of it is removed, we may actually have to transplant a cadaver tissue in there. This is an opportunity where potentially 3D bioprinting may actually be able to create a new meniscus or segment of the meniscus that we could then repair into that defect.
What do you think about that? That's very cool. That's going to change the way you treat patients.
I think it's exciting. I think we're on the forefront of some neat things in the next 5, 10, 15 years.
All right. Well, we are going to send it back into the studio with Alexis Del-Cid, who is standing by with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, with our COVID count and some COVID headlines this morning. Good morning to both of you.
Good morning, Jess. Dr. Hawkinson, I have a few headlines.
Yeah.
Before we get to those, though, how's the COVID count over the weekend look?
COVID count is actually doing pretty good for active infections here in the hospital. Right now we have 21 active infections, 3 in the ICU, none on the ventilator, still 20 in that recovery period. So overall, this is a good step in the right direction. Let's see how the trend goes for this week. Hopefully we can keep it in those low 20s and even getting down into the teens.
That would be nice as we head into the cold months.
Mm-hmm.
We want to get to our headlines because there's a podcast called Science Weekly series
Yeah.
that forecasted the twindemic that we've been talking about of the coming of flu and COVID at the same time.
Yeah.
The UK reports a 42% increase in COVID cases already.
Mm-hmm.
So what do you make of that news and how does it relate to us here?
Yeah, I mean, I think first of all, if we're talking about influenza, we have to really take our cues from what happens in the southern hemisphere just before this time period. And certainly Australia, we know, has seen the worst flu cases in the past 5 years. So we do and are expecting more circulation of influenza virus. That is on top of what we now see with the SARS-CoV-2 and COVID-19. So I think it is a real concern, and that is why it is so important to really be up to date with those COVID boosters and also get your influenza vaccine. Right now, activity still remains fairly minimal for most of the United States for influenza, but if you look at the latest data, we know that those trends are increasing.
There's a common question that a lot of us are asking and being asked, which is with winter on the way, what are the odds of any of us catching COVID a second time, a third time, or God forbid, a fourth time? And then if that happens, what will your symptoms be like? Will they be the same as the first time you caught it?
Yeah. So, I mean, I think we do have to expect, and we know there are already people who have had it 2 and 3 times. And some people have gone out and done those high-risk situations, such as meetings, concerts, being out to dinner and eating around a lot of people and have never got it. But we know there are those people that have had it 2 or 3 times. I think that is very reasonable if you're in doing those activities. What are the symptoms going to be like? Hopefully, if you've been vaccinated, number one, you have good immunity buildup. That's B cell and T cell immunity. And then what are those symptoms going to look like? Hopefully they will be less symptoms or certainly go on for a shorter time period. But it's really difficult to say exactly. We know that there are so many individual factors in there as well. But again, we know that even if you've caught it 2 or 3 times, if you've had COVID 2 or 3 times, they're going to get it. If you've had that vaccination, that is going to be the best thing for overall protecting you against risk of hospitalization and severe disease.
This is and to piggyback on that, like for example, I got COVID last March.
Yeah.
Was really sick.
Yeah.
If I get it again, am I going to be really sick again? Is it going to be a repeat, or will it be less because I already had those bad symptoms?
Right, and we know that you were vaccinated.
Right.
You were up to date as in the recommendation. Yeah. So it's really difficult to say. I don't think there's a good crystal ball or a model for projecting what the symptoms will be like, unfortunately. We hope that because, number one, you've had the vaccines, but also you've had the infection, so you have that immunity to those other parts of the virus, that your symptoms overall will be less severe, because I know you were in quite a bit of pain for some while.
I was on the phone with you, calling you, asking for anything.
So, hopefully they will be better. They will be less significant, minimized compared to those other times. But there are people who've had it 2 or 3 times as well who just maybe say, I had a sniffle for 2 or 3 days. So it is very individualized.
A big change coming October 20th. Starting October 20th, state and local health departments will only need to report their new COVID-19 cases and deaths to the CDC weekly on Wednesdays. That's instead of daily. What does this change signify?
I think it just continues to signify the change of moving towards a normal non-pandemic period. Understanding that people are going about their lives as if the virus doesn't really exist, COVID-19 doesn't exist. Again, some people said the definition of pandemic is how much does it impact your daily life and what you're going to do. This is one more signal of that. Hopefully, although the cases still are high, hopefully the cases will remain low, but more importantly, those hospitalizations and deaths remain low. And that's what they're doing right now with influenza. You know, it is a weekly update on the CDC. So I think we just have to wait and see how it's actually going to be. And again, they can always switch back to daily if we see an increase in cases, hospitalizations, and deaths.
But for now, this is good news. Seeing this change, or encouraging news.
Absolutely.
Right? We do have some community questions coming in, but first I want to ask if there are any reporters on the line with questions. All right, let's get to those community questions because we have a lot of them. First one is from Tom. Tom writes that he's read how stem cells help with cancer, but he wants to know, can stem cells also be used to repair a torn shoulder muscle?
Dr. Shuffle? That's all you.
Sure. Yeah, I think there's about a 5-hour response to that question, but absolutely. Yeah, that's something that is kind of a blossoming area of orthopedic sports medicine, and we call that whole group of treatment options orthobiologics. So that includes stem cells, platelet-rich plasma injections, or PRP, amniotic tissue even. So it's kind of the use of biologic tissue or biologic substrates to try to heal muscle or tendon. There certainly are some circumstances, for instance, partial thickness rotator cuff tears, where it has some good potential at least. I think other areas for knee arthritis, etc., we also have some pretty good data to suggest it at least improves pain and function. But there's a lot that we still don't know exactly how to dose it, how to concentrate it, how many times to administer it. So it's an area of research that is rapidly increasing right now. And I think, you know, in the next 3 to 5 years, we'll have a pretty good idea of what the best applications are for that.
Joellen McGranahan has a question about these injuries. Joellen writes, what are the long-term effects of these injuries and the surgeries?
I imagine that we're talking about shoulder instability and labor repairs, and some of that comes back to what concomitant injuries occur, because there are certainly things that increase risk of recurrent dislocation and potentially arthritis down the road. But in a lot of circumstances, for instance, like Wanyé's, where it is just a labral tear and there's no bony injury to the cup side or to the ball side, there's no associated rotator cuff tear, nerve injury. When that labrum is repaired and you stabilize that shoulder, the long-term risk actually is much better than if you leave it unaddressed and he has continued instability. That's really where the risk of long-term arthritis comes from.
Fanny Mendelberger wants to know if the orthopedic docs refer their patients to occupational therapy for shoulder injuries.
Both physical therapists and occupational therapists will treat our shoulder patients after a surgery, so they certainly may be the ones taking care of them, but it very well may also be a physical therapist.
How would you decide between occupational therapy and physical therapy for people out there watching that don't know the difference?
Well, some of that I think is access. Some of that has to do with what their desired activity goals are. You know, for an athlete, I think a lot of our sports medicine physical therapists probably have a little bit better background than that. But I think there's a number of occupational therapists that are very qualified to treat that as well. So it's kind of a case-by-case basis.
My mom was an OT for 45 years, so shout out to the OTs who are watching. I have some questions also from viewers coming in for Dr. Hawkinson. Jean would like to know, how soon after having COVID can you get your flu shot?
Yeah, I mean, I think right now it is a good time to go get your influenza vaccine just because we know that activity is increasing. How soon can you get it? Certainly it's the same as other vaccines, including the COVID-19 vaccine after you've had COVID. It's really once you're out of that isolation period. We don't want you out in public when you could potentially spread it. So that is really kind of the baseline answer is once you're out of that isolation period, you can really go get any vaccination you would like.
Vicki Martin Hall would like to know, well, she writes, I've had 4 COVID shots. The last was in April before the bivariant shot came out. Do I still need a 5th? What would you tell Vicki?
Yeah, I mean, I think the recommendation is to go ahead and get that dose of the bivalent vaccine. That would be the general recommendation from the CDC. So I think that's a good idea. And again, we know that although circulation of the virus is lower right now compared to what it has been, we are expecting it to increase. And just what you said, Alexis, we know that in the UK and in Europe, those cases are increasing. So it'd certainly be reasonable, especially moving into now the holiday season would be a very good idea to get it.
Okay, Courtney just joined our program. She has a question for Dr. Darsh. She wants to know about something called a slap repair procedure, and she wants to know what that is. So do I. I don't know what a slap repair is.
Well, thank you for the question. I'd love to answer, but I'm going to defer to Dr. Schreppel, who actually does that surgery.
Okay.
So SLAP is an acronym that was coined back in the early 90s. It just stands for superior labrum anterior to posterior. So it's actually a variant of the labral tear that Wanye had. It just happens to be more towards the top of the cup as opposed to the front, which creates the stability of the shoulder. So SLAP tears we see more commonly in overhead throwers because that's also the attachment point or origin of the long head of the biceps. So SLAP repairs are something that actually we're doing less and less of over the last few decades as we understand more about throwing shoulders and how to best treat these non-surgically. But to, I guess, answer your question more directly, a SLAP repair is anchoring of that labrum across the top part of the cup.
Matt has a question. Matt writes that he's a former college football player, suffered the same injury as Wanye. So his question is for Wanye. Wanye, Matt wants to know how it's affected your play post-surgery and if the surgery has made you a better player now.
Yeah, I think the surgery definitely has made me a better player just because I'm able to do a little bit more now. Like before, I was obviously still had good range of motion and all that type of stuff, but it just feels like a lot more stable, a lot more stronger now than what it was previous to my injury.
Taylor Bonison has a question for Dr. Hawkinson. Taylor wants to know if the flu vaccine prevents you from getting and spreading the flu, or if it just prevents you from getting it, but you can still spread it.
So the influenza vaccine won't prevent you from getting influenza if you're exposed, but what it will do is reduce your risk of that severe disease. And really, that's all vaccination. It's really very difficult to create a vaccine that actually prevents infection. The vaccine is made to reduce disease, and that's for any of these disease processes. So the same thing for influenza.
Right.
It is going to reduce your risk of having that severe disease, having to go to the hospital. That is the goal of the vaccine. And again, every year we see varying amounts of efficacy in the vaccine compared to the circulating influenza strains. But if we can bring it back to COVID-19, we know that COVID-19 vaccines continue to do a very good job also of significantly reducing your risk of hospitalization and severe disease.
I have one last question for Dr. Hawkinson. One of our viewers, Pete, wrote in, last week the CDC ended its country-by-country COVID travel advisories. So what impact does this have?
Yeah, I mean, I think for most people, if you've seen the news articles, the amounts of travelers and TSA and long lines and delayed flights, I'm not sure really it had any impact when they were continuing to report on those and have their list of countries not to go to. We know that the people that are very concerned about their individual health are doing those things to reduce their risk, such as not traveling, such as wearing masks, but there is a vast majority of people who were still going about their daily lives and traveling where they wanted, when they wanted. So I'm not sure too many people in general were taking heed to those advisories.
I want to toss it back out to Jess at Arrowhead Stadium so that our guests out there can give their final thoughts.
All right, thank you so much. Before we get to Wanye and his mom, Lauren, Dr. Darsh, I just wanted you to just give your not your final thought, but I want you to let us know just how important it is to have that open line of communication between the parent or the caregiver and the student athlete, especially when, I would imagine when they come into your clinic, just making sure that everybody is feeling comfortable to share how they're feeling and making sure that relationship that we see between them is exactly what I would imagine you want to see. It's kind of a family affair, right?
Sure, of course. I mean, having an injury, especially high school athletes, and I've been through it with my own kids, they've had injuries as high school athletes, And for a parent, it could be pretty stressful. For the kid, obviously, it's a big deal. But there's different levels. The kid has to understand you do everything you can to hopefully prevent injuries, but that's usually not possible. When they do occur, then all the levels of care that you have, your athletic trainer on the sideline, you have to have a relationship with them and trust their judgment and report injuries to them, and then down whatever needs to happen after that when you see your physician, and then if you do end up needing surgery, you got to be in the right hands, and then the recovery after that. So it's a big family affair, and it's just I've been through it. It's just as stressful as probably worse as a parent. I dealt. Oh yeah, my own injuries. Oh, you deal with them. It's not a big deal.
But when it's your kid, it's different.
It's a bigger deal. Yeah, you worry about it, and you want to make sure that you get the best care possible.
Absolutely. Lauren, I know that's how you felt. Just your final thoughts as a mother, and what can you share with our community on what we should know and maybe the questions we should be asking when it comes to our student athletes?
Absolutely. Just as a mother, my very first question for Dr. Schroepel was, will he be able to play football at the collegiate level? That was one of my big worries. I've been preparing him all his life, and football has been his life, so I was worried about that. So I'm just very glad that Dr. Schroepel took very good care. I think as a parent, the biggest thing is to ask questions for the physicians, the trainers, the therapists, to see what we could do as a parent to support a student athlete into recovery.
Wanye, thank you so much for sharing your story with us. Final thoughts from you today.
Yeah, basically just piggybacking off what my mom said, really just asking questions. Because, I mean, I know I wasn't the person to sit there and just ask Dr. Schroepel a whole bunch of questions on what's the surgery going to be like, or what exactly are we doing. I had my mom there for that, and I kind of thank her for that. So I think just having somebody in your corner that can ask those questions and help you get a better understanding of the type of surgery that you're going into and the type of treatment that you're getting after.
Thank you both for joining us today. We really appreciate it, and just be well. Dr. Schroepel, never be afraid to ask your doctors questions, right? It's okay.
Yeah, Wanye, I think spot on right there. I think he's a man of few words, and and so I think one of the things that benefited him and benefits our patients so frequently is just having a good support network.
Yeah.
Because it's tough. It's a lot emotionally. It's a lot physically to go through when you have an injury like this, particularly a season-ending injury. And when you have a rehab for this, really 6-ish months, but ACLs sometimes even 8-9 months. It's a lot. It's a long process, and I think it's really important to have good support, good family members, good friends that are helping you through that and helping you understand why you're doing it, but also helping get you to the finish line.
And I like Lauren's question. Obviously she cares most importantly about her son, and we know that. That's very clear. But she asked that question, is my kid going to be able to go on and play college ball?
Yeah.
There's nothing wrong with wondering to know, how is this going to end?
Yeah.
I just want to know that this is going to have a happy ending. Dr. Darsh, now your final thoughts, and just what can you leave us with on this Red Monday today?
Well, I think we've covered already what we got to do to be able to play football, and now we're all I got to say is go Chiefs.
Right? Okay.
How about that?
Hey, I don't think you could say it any better. I love it. Thank you guys so much for being with us today. And yes, good luck tonight. I'm going to send it back to you, Alexis, and Dr. Hawkinson in the studio for those final thoughts.
Jess has the best seats right now for tailgating.
I know.
I feel like you should just stay out there.
I thought she was going to stay.
Maybe she will.
Although I think Jill wouldn't appreciate that.
It's so gorgeous
but I
out
think
there, right? Jill's going to want her back to do some work here. Dr. Hawkinson, what are your final thoughts?
Again, it's always good to see young people out there being active. I'm glad that he could get back out there and do what he loves. Overall, great questions today. We know that influenza activity is increasing. I think the velocity of that increase seems to be fairly high if you're looking at the latest statistics and data. So it is vitally important to go out and be up to date with your vaccines. Go get the influenza vaccine. Go get your booster for COVID-19. We know that maximum immunity takes that 10 to 14 days. So I think it's important to go out and do that. And otherwise, everybody have fun and enjoy the Chiefs tonight.
Go Chiefs.
Yeah, that's right.
We have an interesting study to tell you about involving teenage athletes. It's a recent study where researchers found that many teen athletes say that they're no longer feeling depressed or anxious over the impact of COVID-19 on their sport. Researchers with the University of Wisconsin School of Medicine found that many of those teens say they're feeling better physically and mentally now that they're able to simply play their sport again. Researchers say for both children and adults across the board, sports and physical activity are huge stress relievers. And you know this guy by now, certainly after that game 2 weeks ago. Kansas City Chief and rookie Isaiah Pacheco stopped by the Proton Therapy Center at the University of Kansas Cancer Center for a tour. He says he's really enjoying getting to know what Kansas City has to offer, including some of the best health care in the region. And Isaiah made the days of some of the patients with his surprise visit.
This is definitely an awesome highlight, man.
For sure.
I'm gonna get a hug in.
Yeah,
Sorry.
definitely. Yep.
Oh, it's so nice to meet you.
Appreciate it.
That's so sweet. Isaiah, like so many, has also been touched by cancer. He lost his grandma to the disease, so he was really glad to be able to spread some smiles here.
Coming from a family where my grandmother had cancer, and passed away, so definitely coming from New Jersey all the way down to Kansas City, to come down here to the Proton Therapy Center is amazing, and I'm looking forward to hear more about it.
The Proton Center opened this past May and so far has treated 51 patients. Thank you so much for joining us for this very special morning medical update. Remember, you can catch our updates anytime by logging on to Facebook, YouTube, and Twitter. Go out and make it a great Monday, and we will see you tomorrow right here at 8 a.m.
Coming up tomorrow on the Morning Medical Update, why having direct access to clinical trials matters when facing breast cancer. I'm Jessica Lovell. Tuesday, you'll meet a breast cancer survivor working with researchers to improve cancer care. You'll hear Tracy's story, and we'll introduce you to a world-renowned radiologist on why they chose the University of Kansas Cancer Center to treat patients.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.